Do you ever find yourself thinking that running is painful? Are you wanting to go on long runs but are held back due to pain behind your kneecap that is difficult to describe? If you had to describe the pain, would it be worse when running uphill and it feels like a sharp and achy pain? If the answer to these questions is yes, then there is a good chance that you are experiencing what is known as runner's knee. So what is runner's knee, or what is medically known as Patellofemoral Pain Syndrome? It is a running injury which is caused by a constant strain on the upper leg muscles known as the quadriceps and the kneecap, patella. When too much repetitive force is placed on the quadriceps and patella, they experience what is referred to as repetitive overloading. This repetitive overloading is what causes the common running injury called runner's knee. To avoid repetitive overloading, it is important to be aware of the term optimal loading, as this is the key in avoiding many running-related injuries. Optimal loading allows runners to exert the correct amount of training and force for their body, and therefore reduce the risk of injury. To reduce repetitive overloading and better meet your optimal loading capacity, you can try the following. Reduce your pace. Run shorter distances. Diversify your workout schedule with low-impact activities like cycling. Take it easy on the hills and ideally run on flat and soft surfaces. Interested in finding out more about runner's knee? Check out the exercise video in the link bio or go to fysiomick.nl for more information.